Good morning, and thank you for joining us today as we discuss your accountable care organization and the benefits of participating in our Baptist Health Texas ACO. My name is Heather Williams, and I am the Population Health Manager for our Baptist Health Texas ACO program with Aetna. Some of the benefits of the ACO I have to do. One is you're choosing CUPIC, our Aetna Whole Health program, which gives you and your family access to highly coordinated, member-focused, and doctor-driven healthcare. And again, CUPIC stands for Quality Partners in Care, and it is a partnership between Health Texas and Baptist hospitals. But it is also in partnership with Aetna as well, which is why it's that Aetna Whole Health program. We do operate in 4 counties only. We operate in Bexar, Comal, Kendall, and Guadalupe. Some of the things that we're going to talk about today are the quality of the care, primary healthcare partners, our hospital network, the provider network, what does the ACO cover, and the educational materials or events that we have available. For the quality of care, we have one, our biggest part is our patient and our member is that focal point. So we take everything and pull it together for our patient. It's that we provide support and resources for self-care. So we want to make sure you're getting, if you need mental health services, we're getting those services for you. We're coordinating care. So we have our case management team, and their phone number is 210-268-1698. So if you need coordinated care, you can work with our case management team, and they would work to make sure that you're getting the right services at the right time with your provider, as well as with any specialists that you may need, and making sure that you're going to providers that are inside the network. We want to make sure that we're improving our performance. So one, we want to keep our members out of the ER that are unnecessary ER visits. So for example, somebody going to the ER for strep throat, that there's other avenues that a member can utilize, such as urgent cares or telemedicine, or even reaching out to their primary care physician. We also have access to same-day sick appointments for our members at our Health Texas clinics. We want to make sure that our members are getting in for their quality measure, their screenings. So if they're getting their mammograms, their well woman exams, their colonoscopies, because the mammograms have changed from age 50 to age 40 this year, and then the colonoscopies changed last year from 50 to 45. So we do want to make sure that our members are getting the screenings that they need. Convenient access. We do have same-day sick appointments available for our members. We also have access to, so Health Texas has 18 locations. We do have one in Schertz, and we do have one in New Braunfels as well. But we have other locations within San Antonio. But there are other provider groups that are within our ACO network as well. But we do have appointments typically starting at 7 o'clock in the morning. At some locations, they do go until 5. But we do have availability. But we also have 2 clinics that are open on Saturdays from 8 a.m. to 5 p.m. So if you're sick, you can always go to one of those 2 clinics. You can call, schedule an appointment at 210-572-8890. Let them know that you have Aetna Whole Health and that you're wanting to schedule a same-day sick appointment. Those visits would be your office visit copay with the PCP versus your urgent care copay or the ER copay. Health Texas does have a secure patient portal that once you're established with a Health Texas provider that you have access to, and you can reach out to your provider and provide notes and information that way. We do also have wellness and disease prevention. So we actually have some educational classes. We do monthly health talks regarding different topics. Mental health over the last few years has been one of the main focuses for wellness, but we also have, for example, GTA Wellness is a nutritionist that's part of our ACO network. So we also have wellness classes that happen throughout the week and also on the weekends. There's diabetic education. We have a plethora of different sources. Some of those recordings are also posted on our CUPIC website, which onto our YouTube channel. And the other is personalized care plans. So somebody who's had an inpatient visit or maybe they've had an ER visit, our clinical team or our case management team will outreach to those members. They will reach out to you. They want to make sure you're getting the care that you need. They want to make sure that you understand your discharge summary or your discharge orders, and that you've scheduled your follow-up visit. If you don't have a primary care physician, we're working with you to establish a primary care physician. You will get an email in the beginning as a welcome email, as well as a welcome postcard that will come to you, because we're wanting to make sure that you're aware of what's going on with your plan and that your contacts. As I mentioned a few minutes ago, Health Texas does have 18 locations. You can see some of those locations. We do have a new one in Charts with Dr. Lim, and we do have a location in New Braunfels, as well as there's one right there on 410. There are quite a few others. So if you live in the Stone Oak area, or if you live in some of the Bernie or other locations, there's providers out in those areas as well. You can see based off of the map the different locations that are available with Health Texas. Health Texas does have what's called a HALO televisit tutorial. So if you do have a Health Texas provider, you could download this app and you can review your statements, you can pay your bills, you can also do virtual office visits from that app. So if you do need a televisit, you can still get in. Baptist Hospitals actually has multiple different areas that they focus on. They're focused on cardiovascular, stroke, musculoskeletal oncology. They also have a bariatrics program as well, rehabilitation, laboratory. They do have trauma, level 3 and level 4 trauma centers. They have wound care and Baptist M&S imaging for your ultrasound, CT scans, MRIs, and those screenings that you need for our mammograms at Baptist M&S imaging. Baptist Health System has 7 hospitals. One is new. It's actually opening up in June, but it's the Westover Hills Baptist Hospital. But we do have Resolute that is in New Braunfels. The ones that are also closest to the Schertz area is Resolute, Northeast Baptist Hospital, and North Central. Those are typically those are going to be the closest to the Schertz location. There's also what Baptist has, which are the Baptist neighborhood hospitals, and there is one in Schertz, and there's a new one that just opened up in Converse. And the next closest one after that would be the Baptist Neighborhood Hospital in Thousand Oaks. But so we do have plenty of resources that are available to our ACO members in the Schertz area and other areas within the counties that we work through. As I mentioned, Baptist M&S Imaging would be the imaging centers that are part of our ACO network. So Strict is not part of our ACO network because it's not tied to Baptist. So our members would have to go to Baptist M&S Imaging. There is a location in Schertz. The next probably closest one is the one in New Braunfels. And then we also have North Central. And there are locations that we do work with Baptist M&S Imaging for Saturday mammograms as well. And we will be working with them to get some scheduled for the Schertz location. The labs that are part of our ACO network. If you are seeing a Health Texas provider, the Health Texas lab is part of the ACO network. However, if you are not, you would want to make sure that they're sending your labs to either LabCorp, Quest, or CPL, because the other labs are not going to be part of our ACO network. What to do when you're sick? Again, you do have access to urgent cares. Those are you can walk in with the urgent cares, and that's going to save you money from going to an ER because you're going to have the urgent care copay. You also have access to same sick appointments with our Health Texas clinics. So that phone number is at 210-572-8890. You also have a 24-hour nurse line with Aetna. So you can always reach out to them, and they can help guide you into the right path. Like if you really need to go to, if you should go to an urgent care, or if you really should go to the ER, they can help guide that direction. You also have access to telehealth services. So Teledoc is this particular phone number, but again, you do have other resources. So the different urgent cares that are part of our ACO network is Texas Med Clinic. And it's not just the Texas Med Clinics that are listed here. Those are just the 3 that are open 24 hours. But just know that you do have access to the other Texas Med Clinics as well that are within those 4 counties. The other locations are Next Level Urgent Care, Quality Urgent Care, Concentra, Alamo City Urgent Care, Fast Aid Urgent Care, Next Care. We also have Pediatric Urgent Care as well. And there's one, Little Spurs in Selma. So that's probably going to be the closest one for the pediatric urgent care. But we do now have pediatric urgent care that's part of our ACO network. And one of the other urgent cares that we have is a group called Dispatch Health, if you haven't seen their flyers come through, or mailers. But Dispatch Health is an urgent care that when you're under the weather and you just can't get out of your house to drive over to an urgent care, you can go online and you can call Dispatch Health, and they will actually come to your home. There are certain areas they do not go to, but New Braunfels, Schertz area, Commerce are areas that they do go, but they're not in Canyon Lake, Spring Branch area. But we just want to give you that information and let you know that that is available and is an option to you. And it, again, is going to be your urgent care copay versus an ER copay. So this Dispatch Health, as I was talking about, this is the map for Dispatch Health. This tells you the areas that they work in. You'll see Schertz is one of those areas that they do go to. Converse, they are in New Braunfels. There is a specific area that they are not in, but that is the area that they do work, and they will go out to. One of the other things that was added, groups that was added to our ACO network this year, is a group called OSHI Health, and they are a digestive group. They were so they are a gastroenterology group, but they are virtual. So they're not the brick and mortar where you go and get your colonoscopies, get endoscopies, and whatnot. They're actually virtual, and so but they work on digestive issues. So they can work on if you have digestive chronic conditions such as Crohn's disease, or maybe you have indigestion, bloating, gas, GERD, those type of things. They can help manage those and help get those under control. What they can also do is if you haven't been diagnosed but you're having digestive issues, they can help find a diagnosis, or they can help steer you in the right direction to get that diagnosis. So if they feel based on your symptoms that you need to go get an endoscopy, then they will submit that referral to a brick and mortar in-network gastroenterology group such as TDDC or Gastroenterology Consultants of San Antonio, because those are groups that are part of our ACO network. They would work with those groups in getting that referral over to the brick and mortar group so that you can get that testing and diagnostic. And then they would take that diagnosis and they would work, and they have you then work with not just their gastroenterologist that's on staff, but they would also have you work with their nutritionist as well as their mental health providers, because they're trying to take care of the whole person with their digestive issues. Same-day sick appointments. We're going to talk a little bit more about that. So same-day sick appointments, you can have those even when you're out of town. There's several ways that you can do that. You do have access to Teledoc. So that is one of your virtual telephonic services that you have available to you. You can also schedule, if you have a primary care physician, you can schedule with your primary care with your doctor virtually. And so that is another resource. You can also call, again, our same-day sick appointment line at the 210-572-8890. Let them know that you have that in whole health and that you're sick and you're trying to schedule a same-day sick appointment, but you need to do a virtual visit because you're out of town. those are some resources that you do have available to you. You also have access to Aetna's 24/7 nurse line. That nurse line will be able to steer you in the right direction. They're not going to be able to necessarily prescribe medications. But you can, if that doctor, when you do that virtual visit, prescribes the medication, you can get those medications refilled or filled even out of town. You know, the Kroger, the HEB, the Walmart. You can go to different locations, CVS, Walgreens, and get those prescriptions filled. You're not tied to your specific service area for prescriptions. Now, if it is a true emergency, you were in a really bad car accident and you broke your collarbone, or you're having a heart attack or things of that nature, you're obviously not going to drive back into San Antonio to go see a doctor. If you're having a true emergency, you're going to go to the nearest ER, regardless of where you are, even if you are out of the country. And Aetna is going to cover that service as if it were a network. So just keep that in mind if you have a true emergency. Now, if you do go to that same emergency room because you had strep throat or an ear infection, that is not considered a true emergency. That's something that could have been handled by way of teledoc. It's something that could have been handled by using a virtual visit. And one of the other pieces with the Health Texas, because you're part of that Aetna Whole Health program, you don't actually have to be established with a Health Texas provider to still have access to those same day sick appointments. You just call that line that I shared earlier. You just call that telephone line and let them know you have Aetna Whole Health and you're trying to get in virtually or in person for a visit. Now, you can't walk into that clinic and be seen, because you do actually have to call and make an appointment, because they're going to look at which location is closest to you, or they're going to look at where they can get that virtual visit. Our Aetna Whole Health, your Aetna Whole Health network, does have over 400 primary care doctors, which does include primary care, pediatricians, OBGYNs. There are over 400 plus primary care doctors, and you also have there's over 100 locations. So just primary care doctors alone, there's over 100 locations. Then you have your pediatricians, and then your OBGYNs. We do have 18 hospitals, which does include those Baptist neighborhood hospitals. So there's 18 locations. 2 of those are new that just opened up. There's over 2,500 specialists, and we now have 65 urgent care centers, which does include those pediatric urgent cares. So here's just a quick network map, so you can kind of have an idea of where the different locations are and what they are. So you can see the pediatricians. We do have pediatricians that are in Selma, Cibolo, in the Schertz area. We also have some OBGYNs in that area as well as primary care physicians. So, and you'll see throughout the map the different locations in different areas that we do actually have services for our different for a different type of patient population. Another portion is where you can see kind of a quick summary of where our Baptist hospitals are located, as well as our Baptist neighborhood hospitals and the different imaging centers. It might be a little hard to see some of those imaging centers because some of those locations are actually in the same places as the hospitals, but there are some that are outside the hospitals. You can see the different physical therapy locations. There's quite a few actually. And you'll see the all ages urgent cares, as well as those pediatric urgent cares. And there's a couple pediatric urgent cares that are kind of hidden behind the all ages of the urgent care, but they are there. Like there is one in Selma, which is that Little Spurs. And then there's another one over here, kind of near Alamo Heights, that's sort of hidden. You can still see the blue a little bit, but it is kind of hidden a little bit. There are some clinics that do have extended hours. The extended hours are not as large as they used to be. COVID kind of put an impact on that, with the providers having a lot of burnout. So they've had to decrease the locations where there's extended hours, but there are appointments at 7 in the morning until 5 o'clock in the afternoon at these different locations within Health Texas. One of the others is we do have 2 locations that are open on Saturdays, and those Saturday locations are open from 8 a.m. to 5 p.m. We can work with our members during the holidays and summer and time off and things of that nature too, to try to get our members in with where it makes sense for you. There are some other locations that have extended hours. They're just not in that Schertz area. We do work with several groups that are part of our ACO network to have Saturday screenings, because we know this is a working population, so and a lot of us don't really want to take time off of work. So we do work with optosemnus imaging for mammograms on Saturday screenings and get those scheduled. Those dates are typically on our QPIC website. So that our QPIC website is qpicsa.com. And so you can go there, and at a really quick summary, you can click on the right-hand side. You'll be able to click. It'll say mammograms. It's in pink. You just click on that, and it'll give you the different schedule. Right now, it goes all the way out through August, but you can look at that schedule, and it'll pop up as we update. There'll be more dates as we get further down the years. Colonoscopies. We work with gastroenterology consultants of San Antonio to have Saturday colonoscopies. So that, again, that's important for you guys as a working population, because many don't want to have to take that time off of work. So this is an easy way to do that, or a quicker way, because you're not having to take that time off of work. JTA Wellness does have virtual visits. They are a nutritionist group that is part of our ACO network. They do have virtual visits that are available to our members, and they also do Saturday visits as well. As I talked about, Oshi Health is a virtual gastro group. They are open 7 days a week, 365 days a year, and they're open 24/7. So, which helps, because you never know when you're going to have those flare-ups for those chronic conditions with the digestive issues. And so having them available as a resource helps manage those chronic conditions. And then again, Dispatch Health is an at-home urgent care when you can't leave your home, and they're able to work with you, and they're open 7 days a week, 365 days a year. They're open from like 9 a.m. to 10 p.m. So you would just either call them, or you can go to their website and schedule. Here's just a quick rundown of the primary care physicians that are part of the ACO network. Those that are asterisk are actually have clinics that are in the Schertz area and New Braunfels area. So those are going to be ones that are going to be closest to the school district or the area. There are others that are in San Antonio and the surrounding areas as well. It's just those are the ones that were closest to where you guys work and potentially live. Pediatrics, I did the same thing. I asterisked those that have locations in the Schertz and New Braunfels area, and some in the surrounding areas as well that were closest to that location. Again, I did the same thing for the OBGYNs. So these are the different OBGYNs that are in the areas. Acacia, Kamel Women's Center, Acacia has a location in Schertz. The other locations are going to be probably New Braunfels area. The Caring Center for Women, Mary Gelderneck, Kamel Women's Center, and then but there are others in Live Oak area, and then the Schertz area too, is like Synergy Healthcare and Women's Partners in OBGYN. As I mentioned earlier, we do offer case management programs. So Health Texas, as a partner within the ACO program with Aetna, manages the program itself. So if you do end up in the ER or have a hospital visit for whatever reason, that clinical team is going to outreach to you. They're going to outreach to see if you have any questions. They're going to outreach to see how they can assist you. Make sure that you have information and understand your discharge orders. They're also, maybe you have chronic conditions such as diabetes or lupus or whatever the case may be. They're going to want to work with you and make sure that they're able to help you manage those conditions and get you to the right resources as well as getting you to the right resources that are part of it, that are actually in the network. They will, if you need to be followed, they will reach out to you periodically throughout the month or throughout the year to make sure that if you need any additional assistance. So before having an inpatient procedure or leaving the hospital, you can also call that clinical team, because before you have an inpatient procedure, you're going to want to make sure that the facility that you're having the procedure done is in the network, because a lot of procedures now are being done in surgical centers. So you do want to make sure that surgical center is part of the ACO network. So they can work with you and help manage that and make sure that where you're going is in the network. And again, before you leave the hospital and at discharge, you can call 210-268-1698, or you can also email the clinical team at cubicm@healthtexas.org. And this is even if you are not seeing a Health Texas provider, because again, we manage that population, or that clinical team manages our members who've had health issues or have had an ER visit or an inpatient visit, because again, they just want to make sure that you're getting the care that you need appropriately upon discharge. They want to make sure you have all the right prescription cost savings. On you're scheduling your follow-up visits, because when you've had an ER visit or had an inpatient procedure, they do want to make sure you're getting that TCM follow-up, because you want to make sure that you're healing appropriately and you're getting the right care. We also provide free patient education classes, so they're going to want to make sure, based off of those symptoms, that you're getting the right education services. You do have access to mail order pharmacy as well. So you can, it's the first thing that you would want to do. This is a 90-day supply of maintenance drugs delivered right to your door. It would be a standard shipping. The standard shipping is free. You can reorder those online or by phone. You can also reorder them by mail. One of the other things, so the way that you would want to do this to get started is you would ask your doctor to give you 2 prescriptions for the maintenance drug. The first one is so that you can get a 30-day supply to fill at your local pharmacy right away. Then you'd get that 90-day supply with the 3 refills that you would send in to Aetna, so that they can get that prescription ready for you. You'd complete the form. You can mail or fax it to Aetna with your RX, and that fax number is at 1-877-270-3317. You can mail the order form in, and the link for that is down below, or you can go to Aetna and pull it and type in mail order pharmacy, and the information would pop up for you. That way you can submit the paperwork. If you're wanting to build your care team and you're wanting to find out what's in the network, you do it a couple ways. You can get your concierge service, which would be me. You can reach out to me at 210-920-9301, and I would be able to assist you in finding an in-network primary care physician or even your in-network specialist. Or you can go to the Aetna's website, which is, you can type in www.docfind.com, and it will actually take you to the Aetna.com/docfind. You can continue as a guest, or you can register, and then you enter the location and look within the number of miles that you're trying to reach. You will want to make sure that you're selecting the Baptist Health Texas Aetna Whole Health Network. So, because if you don't select the plan, then it's going to pull all the providers that are part of Aetna into your program, and you may end up finding a provider that's not actually part of your ACO network. So you do want to make sure you're selecting the Baptist Health Texas ACO network, and so that way you're truly getting the right providers that are in your network. Then you can enter the type of provider you're looking for or specialty that you're searching, again, or you can call me and I can assist with that. So this is what it's going to look like. You'll see it says Texas, it says Aetna Whole Health, and it says Baptist Health System and Health Texas Medical Group. And either one of those 3 choices is part of our Aetna Whole Health program, and all of the plans have the same network. So again, our goal is to provide you guys with a positive member experience and provide you the services and the guidance and assistance that you may need. So you do have a dedicated network navigator, which is myself. Again, you can reach out to me at 210-920-9301, or you can email me at QPIC, QPIC, at healthtexas.org. You have access to same-day sick appointments at 210-572-8890. Yeah, if you're needing to reach out to our case management services, that phone number is 210-268-1698, or you can email them at cupidcm@healthtexas.org. There are member welcome videos and e-brochures out on that are available on myetnahealth.com. So you can go there and check that video out. You can also go to our QPIC website, which is qpicsa.com. There's a lot of information out there, plus our future upcoming health talks that we will have are out there as well. You also have mail order pharmacy with CVS Caremark. There's a welcome postcard and an email that will go out to you once we receive the information from Aetna. We have our Working on Wellness, so we can come out to the schools and do health talks. We can do health fairs. We will also come out and do flu clinics. And we have a monthly wellness newsletter that we do send out, and we also do the health talks. It is a provider-directed model. Our goal is to provide coordination of care with the patient and with the member and the providers, with the primary care physician being your main focal point, because if they are not helping you manage your care, then you may be spending more than what you really need to be spending. Because there are many things that your primary care physician can actually manage for you that doesn't have to go to a specialist. It's typically when you're trying to get that diagnosis that they would need to send a referral to the specialist. But once you're managed, that it typically can go back to your primary care physician for that management. But you want to make sure that you're keeping your primary care physician in the loop of what's going on, because they can help make sure that you're getting that referral from the appropriate party. Telemedicine, again, you have access for non-emergent needs when you're out of town or even when you're in town. You have access to that telemedicine services as well. And this is typically what the ID cards look like. It will typically have Aetna Whole Health, Baptist Health System, and Health Texas Medical Group in the middle of that ID card. And they will typically be gold. So I do thank you for your time, and I appreciate you joining me today and participating in this class. And if you do ever have any questions, please reach out to me. I am more than willing to assist. And again, my number is 210-920-9301. And I greatly appreciate your time. Thank you.